Early this morning, thousands of Floridians woke up to news that their appointments to get treatment for COVID-19 infection were canceled by the Biden administration, which outright revoked authorization for two very popular monoclonal antibody treatments that the state of Florida really pioneered over the summer and that we've worked hard to make available to our residents who needed treatment. And so this is something that they claim shouldn't be used because we have Omicron. And what we would say in Florida is we have had people use it and we've had good results. It's not 100%. We understand that. But you also don't even know when someone goes in whether it's Omicron or still the Delta. Yes, mostly in Florida, it's going to be Omicron at this point. But it's really a reckless decision to be able to take this option away from patients when we've had the site set up, we've had this distributed to different medical groups or hospitals. And if somebody wants to try, it was very effective against the Delta. If you look at once that program went in, you saw a huge decline in hospitalizations. And we were proud to be able to fill really a void which shouldn't have existed if you had people, the higher ups, were actually promoting early treatment, which they weren't. So we're proud of that. But even if with Omicron, it's half as effective or even 25% as effective, that's better than nothing for people. And as I've said, anecdotally, we've had people that have had their symptoms resolved after doing it just in the last month of doing this. So this is wrong what they're doing.
FDA yesterday withdrew the EUA for some monoclonal antibody treatments because they don't work against Omicron. But Florida continues to push for the treatment for people in the state. What's your response to Governor DeSantis, and what's your message to the people of Florida?
Well, let's just take a step back here just to realize how crazy this is a little bit. We've approached COVID treatments like filling a medicine cabinet. We're not relying on one type, one brand, or treatment. We invested in and continue to buy a variety across monoclonal antibodies, pre-exposure prevention therapies, and oral antivirals. We have provided 71,000 doses of antivirals to Florida, including 34,000 additional treatments that do work against Omicron just this last week. Of a range of those treatments, I should say, to be clear. What the FDA is making clear is that these treatments, the ones that they are fighting over, that the governor is fighting over, do not work against Omicron, and they have side effects. That is what the scientists are saying. We have sent them 71,000 doses of treatments that are effective against Omicron and are effective also against Delta. And they are still advocating for treatments that don't work. We've seen, unfortunately, from the beginning in our pandemic response, a range of steps or pushes that have been made through social media platforms, unfortunately from the mouths of elected officials, and the advocating for things that don't work, even when we know things do work. Injecting disinfectant, promoting other pseudoscience, sowing doubt on the effectiveness of vaccines and boosters, and now promoting treatments that don't work. We know it works, vaccines and boosters. We have a range of doses of things that do work in treatments, and we're providing those to Florida.
So this is Ron DeSantis lamenting the White House's decision to revoke the EUA, the Emergency Use Authorization for monoclonal antibody treatments. He is so livid over this decision that he held an actual press conference. He took to Twitter too, writing, "Without a shred of clinical data to support its decision, the Biden administration has revoked the Emergency Use Authorization for life-saving monoclonal antibody treatments." In other words, Ron DeSantis seems pretty angry with the White House. Only one small issue: the treatment that DeSantis is losing his mind over doesn't work on Omicron, which is the predominant variant in the US. And don't take it from me, take it from the companies that make monoclonal antibody treatments. Both Regeneron and Eli Lilly both came out in agreement with the federal government that the drugs are not effective against Omicron. Regeneron wrote, quote, "It does not work against the Omicron variant in lab tests, which tells us that it also is not going to work in people who are infected with this variant. According to the CDC, over 99% of COVID cases in the US are now caused by the Omicron variant, and thus the FDA's decision to amend the emergency use authorization was appropriate at this time." Eli Lilly wrote, quote, "Lilly and the FDA agree that it is not medically appropriate at this time to treat patients with mild to moderate COVID with this treatment. Evaluation of both pseudovirus and authentic virus confirm that they are not effective at treating the currently predominant Omicron variant." In other words, DeSantis is complaining that the EUA was revoked on treatments that don't work. Why would you want an EUA on a treatment that doesn't do anything? Wasn't it the Republicans who were losing their minds before the COVID vaccine itself was granted FDA approval because they were so hell-bent on making sure that the science backed up the vaccine? And yet now, when not just the science but even the company that stands to profit both agree that the treatment is worthless, now they want an emergency use authorization anyway? Dear God, make up your minds. And yet, if you're looking for the reason here, it's actually quite simple. It's all political. This is where Republicans like Ron DeSantis planted their flag. Apparently, the left co-opted vaccines. Those are a Democrat thing now. And so the right decided that they'd claim ownership over monoclonal antibody treatments. And the utter stupidity of this imaginary contest is not lost on me. Medicine doesn't care if you're a Democrat or a Republican. It'll either be effective or not. We know that 99% of Americans getting hospitalized and dying of COVID are unvaccinated. Or put another way, the vaccine is more than 99% effective at keeping you alive. If Republicans cared about public health as much as they care about politics, they'd use the damn vaccine because it's the single most effective tool that we've got. But because they don't care about public health as much as politics, somehow the vaccine has become a third rail on the right. But obviously they need something to try and mitigate the hundreds of thousands of deaths, and so they landed on monoclonal antibodies. And so when that got taken away, again, because it doesn't work, then they got really mad because that was the thing they laid claim to. And I'm sorry, but even saying all of this out loud really does drive home how fucking stupid it is to politicize a public health issue. Imagine, like, a child has a soccer ball, but then that soccer ball gets a hole in it and it deflates. And so you try to take it away because you might want to replace it with a different soccer ball that, oh, I don't know, doesn't have a hole in it. But when you try to take it away, the kid loses his mind and throws a tantrum because even though the ball is completely deflated and doesn't actually serve its purpose, it's their ball and so they want to keep it. In this analogy, Ron DeSantis is that child, and his precious monoclonal antibody treatment is the deflated soccer ball. So look, this should go without saying, but then again, it's 2022 and no one's ever lost money betting on the stupidest idea winning out. If Ron DeSantis actually wants to help people, he should promote the single most effective and safe measure that exists. A measure that would make it so that we don't even need treatments because we'll already be protected against serious illness, and that's the vaccine and the booster. But DeSantis won't even bring himself to say whether he got the booster. And that's all the proof you need that he's not in it for the well-being of his constituents. He's in it to pander to a faction of far-right conspiracy theorists that run the Republican Party. And so as more Floridians die under DeSantis' watch, just remember that many of those deaths are wholly avoidable, if only the governor actually cared about the lives of the people that he took an oath to protect. To see more videos like this, click the subscribe button right here on this screen. And if you want to support my work, subscribe to my podcast, No Lie with Brian Tyler Cohen. I cover the most important stories each week, and my guest is always one of the top political figures, including Vice President Kamala Harris, Jen Psaki, Elizabeth Warren, Pete Buttigieg, Nancy Pelosi, Katie Porter, Cory Booker, and so many more. The podcast link is also right here on this screen, so give it a listen and subscribe on Apple Podcasts, Spotify, or wherever you listen to podcasts.